Hello, everyone. We're just going to get started in a minute. I'm just letting some of the participants in, and we'll get started. Okay. Let's see. All right. Munaz, I think I'll get this started.
Perfect.
So, hello, everyone. Yeah, thank you for joining us today for our webinar on how Sightsavers global work is increasing voice and opportunities for the most marginalized in society. I'd like to start by introducing our esteemed member Sightsavers. Sightsavers is an international organization working across more than 30 countries in Africa and Asia to partner with governments, foundations, and civil society to eliminate avoidable blindness and promote social inclusion for people with disabilities. At a time when inclusive development is essential to achieving the Sustainable Development Goals, Sightsavers offers both evidence and practical models for systemic change, ensuring that no one is left behind. And now it's my great pleasure to introduce Munaza. Munaza Galani is the Sightsavers Director for Pakistan and the Middle East. Thank you, Munaza, for being with us. I'm going to hand this over to Munaza in a second, but let me tell you that Munaza brings more than 20 years of experience in social development and public health. She's led efforts to eliminate trachoma in Pakistan, expand inclusive education, and strengthen primary eye care through community-based health workers. She's also a passionate advocate for women's rights and disability inclusion, and she serves on several national and regional advisory boards that shape policy across health, education, and gender equality. We're truly honored to have you here with us today, Munaza. You're truly a remarkable leader whose vision and dedication continue to open doors and create opportunities for those left behind. So thank you so much for being here with us today.
Thank you. Thank you so much, Nihal. It's a great pleasure to be on this very insightful platform. We are not very old members of the AFF. We recently joined. It's been a year now, but so far it has been a really insightful experience learning from other members-led sessions, and also I got an opportunity to get connected with few of you. So thank you very much for giving me this opportunity today to share some insights and some learnings from our program portfolio, and also sharing some more information about the type of work we do, whom do we partner with, and what kind of impact we aim to create for the most marginalized communities in the most underserved and marginalized geographies of the globe. So, as Nihal mentioned, I'm actually the director for Pakistan and Middle East. And I would like to share a presentation. Let me share my screen. Please let me know when this is visible.
Yep. Yes, I can see it, Munaza.
Okay,
Yeah.
perfect.
Yep.
Okay, so as Nihal mentioned, we are an international NGO working in 33 countries globally, and we primarily work in partnership with the local governments, with NGO partners, with organizations of persons with disabilities and local communities to protect sight, to prevent infectious diseases, and we also campaign for the empowerment of the rights of the persons with disability. So since last 75 years, as we were founded in 1950, our work is now in more than 30 countries across West and East Africa and Southeast Asia. So based on our program portfolio, we have been able to create a lot of evidence and learning for replicating the type of work that is needed to prevent and control blindness in the world, as well as our experiences around empowering persons with disabilities through different interventions in all domains of life, be it eye health or education or economic empowerment or creating more employment opportunities for persons with disabilities and other marginalized groups. So when it comes to the vision of the organization, our vision is of a world where no one goes blind from avoidable causes and where people with disabilities can participate equally in the society. And to achieve this vision, we partner very closely with the existing systems and structures in the countries where we have our presence. And when I say investing in the systems and structure, that means that we work very closely with the governments. We do not create any parallel structure to them. We strongly believe to play the role of a catalyst, where we partner with governments to identify the existing gaps in the health system, in the education system, in the employment sector for the most marginalized people, and then we work hand in hand with the governments to address those gaps. So our work is basically based on some strong facts and epidemiological data. And based on that, so far since 1950, we have been able to provide sight transforming cataract surgeries. 9.25 million cataract operations have been performed with the support of the Sightsavers since 1950. We have been able to provide around 1.7 billion treatments, primarily for NTDs and other eye health conditions. And similarly, for empowering persons with disabilities, so far we have trained around 342,000 people with disabilities in order to help them for a living and to have an economically independent life. So these are just the snapshots of the overall figures since we started our work in 1950 so far. If you can see on the screen, the geographical presence. This is the map showing our presence in West and East Africa. We are prioritizing those geographical locations that are the most poorest, plus the low and middle income countries, based on the need of the work that we support for prevention and control of blindness, for promoting disability inclusive education, for enhancing the social inclusion of the persons with disabilities by working very closely with the organizations of persons with disabilities, and also empowering them economically by providing them decent jobs, as well as empowering them to be strong entrepreneurs in the society. So what exactly we do to achieve our aims? First of all, we protect sight. So based on the available data through national blindness surveys, different rapid assessments of avoidable blindness in the regions and geographies where we work, we prevent avoidable blindness in some of the poorest parts of the world. And we identify the most common causes of blindness, which are still cataract and refractive error. There are some other emerging causes of blindness, such as diabetic retinopathy, that we also address in some countries where we are working. Um, Similarly, for fighting NTDs, neglected tropical diseases, we work very closely hand in hand with the local governments, with the primary healthcare system, the community health workers, and the local communities. And as we know that the NTDs are still affecting more than 1 billion people worldwide currently. So there is a great need to prevent and timely detect these diseases and develop a referral chain for any complicated cases for their timely treatment. For the disability rights, we promote equal opportunities for young people with disabilities, and at the same time, we campaign for better awareness in the local communities and stakeholders, as well as for policy influencing processes and key decision-making processes. So we give the organizations of people with disabilities and opportunities to be present and to be vocal at the decision-making tables. They should have an exposure and a voice at those forums so that they themselves can raise their voice for their rights rather than anyone else speaking on their behalf. And that's the reason we work very closely with the organizations of people with disabilities. So what is our approach in this context? So for changing the life outcomes for children and families, we invest in the primary healthcare systems, in the secondary and tertiary healthcare systems, where we invest for the service delivery, improved service delivery mechanisms, for better infrastructure in the health system, for equipping the human resource available in the health system, so that they are better able to deliver quality eye care services for the children and families, and for the most marginalized, such as older persons, transgender, ethnic and religious minorities in the geographies where we work. And in this whole process, we try our best to leave no one behind, especially for the communities who are the hardest to reach, and and to achieve the sustainable development goals in a way that every single person is benefiting from the interventions and the services that we are providing in partnership with the governments. And that is the reason that we support within the system. We train the existing human resource of the government primary and secondary health systems in the similar way for education. We invest for the government teachers capacity building. We support them for better education outcomes of the children. In that way, we do have school eye health screening programs where where the school children are screened for common eye care problems such as refractive errors, squints, and others. And once they are identified, they are examined by the trained professionals who, after screening them, provide them with the free eye spectacles. And for any complications, they are referred to the tertiary level eye care setups. And in this whole scenario, we try to create a strong evidence and learning based on which these innovative solutions can be replicable, scalable, and sustainable. And that's very important because unless we are unable to create such models, we cannot sell these innovative solutions to any of our stakeholders, and especially to the governments. So our role is basically to demonstrate the solutions for the government and for other stakeholders, and those solutions should be replicable and scalable. And once the solutions create that evidence for the true solution of the problem, they are adopted by different stakeholders in the countries where we work. So for protecting sight, our our interventions are based on some very strong facts and statistics. For example, currently around 2.2 billion people have a visual impairment globally. But the good news is that nearly half of the blindness and visual impairment can be treated or prevented if detected and treated timely. But for that, the health systems needs to improve in parallel with a strong consistency. And unless these eye health services do not improve, the number of people who are blind can become triple to to an estimated number of around 115 million by 2050. So it's really important that we keep on improving the eye care services. We keep on escalating the number of service delivery options and centers at different levels of the country's health system where we work in. So continuous sustainable infrastructure and human resource workforce is very much essential. So what are those eye conditions that we treat? These include some of the most common ones, such as cataract. You know that this is the most common problem and a cause of blindness globally, and this is basically caused by a buildup of a protein with the age that clouds or blurs the eyes a natural lens, and this can actually lead to a very blurred vision, and eventually this can also cause blindness. Similarly, refractive error, in common layman words, we can call it weak eyesight. And these are kinds of disorders which are caused by a kind of an irregularity in the shape of the eye. This is very common in the children, especially in the school age children. And for that, we have initiated school health integrated programs where we provide such services of screening and treatment to the school age children, both in the school settings as well as in the out of school informal education settings as well. Similarly, other problems are glaucoma and diabetic retinopathy. I'm not going to talk about the type of disease, but these are the four most common causes of blindness that we primarily work for to prevent and treat. So in order to tackle these problems, what do we do? As I mentioned earlier, we strengthen the existing health systems for the long term in a sustainable way. And that is only possible if we target the public sector health system. Similarly, for the human resource capacity building, we build their human resource by training surgeons, ophthalmic technicians, nurses, and other mid-level eye care health professionals who are part of the multidisciplinary team to tackle the major causes of blindness. Similarly, we also educate people about eye health and how to get treatment. And for that, we run massive awareness raising campaigns in all the countries where we work. We provide them assistive devices such as eyeglasses or low vision aids. And in this whole cycle, we bring the treatment options very, very near to the local communities. And our experience and our data so far shows very strongly that when these services are available within the primary healthcare system, closer to the communities, the uptake of the services always increases dramatically, especially for those who have limited access, such as women, children, and older persons. So for fighting the most neglected tropical diseases, we support the governments and other partners to prevent 5 neglected tropical diseases primarily. And currently, these 5 diseases are affecting more than 1 billion people in the world. Um, out of which 125 million of these people are at the risk of going blind from trachoma, which is the world's leading infectious cause of blindness. And we have been running some major programs in the countries where we work for the elimination of trachoma. In lots of countries where we partnered with the government and other PRI NGOs and local communities, we were able to eliminate trachoma in a number of countries, and we are still working in some other countries where this is still a risk of blindness, and we are helping the communities and the government to get rid of this infectious disease. So these are some of the most common NTDs in relation to the eye health and some other problems, which includes trachoma, river blindness, lymphatic filariasis, LF, which is commonly known as LF, snail fever, shitso, which is also called shitso, and intestinal worms. And that's why intestinal worms is still a problem in most of the poorest communities of the world, where we support the communities through MDAs, Mass Drug Administration, and also in our school health integrated program, where we run deworming campaigns to help children getting rid of of this issue and problem. So how do we do that for the NTDs elimination and prevention? We distribute millions of donated treatments of medicines to protect the entire communities. And to reach out to the communities, we work very closely with the primary healthcare systems. We train community health workers to deliver the NTD care and also help us in mass drug administration processes. We promote good hygiene by educating the people about the the significance of a clean drinking water and good sanitation system. And for that, we run social behavior change campaigns and awareness raising campaigns in the communities with the social influencers as well as with the community influencers to have a long-term change. And within that, we train volunteers to check people's symptoms and distribute medication, not only in a one-off activity, but through a sustainable and consistent interventions on long-term basis, so that we can detect any problem cropping up in the future as well. So when it comes to disability rights, as I mentioned earlier, that we work very closely with the organizations of persons with disabilities, the leadership of the persons with disabilities themselves, mainly women with disabilities, to promote equal opportunities for them and to campaign for disability rights so that all of them can learn, earn, and be happy. Some of the facts are that one third of the children who do not attend schools have a disability. So amongst the out of school proportion of the children who do not have access to the education, majority of them are children with disabilities. And people with disabilities are less likely to escape the poverty due to many reasons, as they have limited opportunities, limited access to mobility. There is a lot of stigma and taboo attached, a lot of discrimination, and also lack of access to the employment opportunities and workplaces through which they can gain more empowerment. And when it comes to persons with disabilities in low and middle income countries, many of them are routinely denied of their basic human rights in all domains of life, be it health or education or economic empowerment. And that's why disability inclusion, equity, and equality are the cross-cutting themes in Sightsavers program portfolio. So whatever program we design and implement, be it for eye health or for education or for the social inclusion, disability mainstreaming is something that is part and parcel of the whole concept design and implementation, and we work very closely for those who are actually having the lived experience of disability. So what we do to achieve that, when it comes to inclusive education, we try to work with the governments and the local communities to make schools more inclusive and accessible for children with disabilities. We strongly believe in the economic empowerment of the young people with disabilities who are the job seekers, but at the same times, we also build the confidence and capabilities of the employers to hire people with disabilities, not only hire, but also to retain them in their workplaces, and how to make their recruitment policies, their work environment more accessible for young people with disabilities. For health, we try to generate evidence on what works to include people with disabilities in health programming. What does it mean? It means that for making our eye health services accessible to persons with disabilities, it is really important that the infrastructure, the human resource, and the service delivery mechanisms are disability inclusive, accessible, and affordable, as well as acceptable for this community. And we do it in the form of different interventions, different training programs, by making adjustments to the health infrastructures, etc., etc. We also work with the organizations of persons with disabilities and the disabled communities for their political participation and also in the decision-making processes. So we support them to have a say in the decisions that affect them. So we try to include them in the very local level, grassroots level decision-making platforms. We provide them with different opportunities as well. So just in the end, I would like to mention that what has been so far, our total income, it has been like in last year, 2024, it was 144 million, out of which 80% of that we spent on the prevention of blindness and combating the neglected tropical diseases, and 20% on the disability inclusion, which encompass our work on an inclusive education, on economic empowerment and social inclusion of the persons with disabilities in different sectors and domains of life. So yeah, this was just a brief snapshot of and an overview of what we do and how we do. Um, and I'm looking forward to any comments, any reflection, or any questions. Please, you're most welcome. Thank you.
Thank you, Manaza. Is there a clip that you wanted to play?
I tried in the beginning, but it's not. Do you have a copy of that? If you can try to play it from
The
that end,
video? No, I don't.
because it's stuck. I
Okay.
don't know what's the issue with that.
So yes, anyone who has any questions, please remember to put those in the Q&A section. But I did want to ask you, Munaza, about, so you were talking about training employers and such to employ the people with disabilities. What have you found, or what kind of organizations or workplaces do these individuals with disabilities have the most success? And which employers do you find are the most willing to work? Like what specific jobs are they most welcoming of these individuals?
Um, it varies from geography to geography. If you compare the urban context with the rural context, it's entirely different. But it all depends how much employers have been engaged in the process of influencing and changing their mindset towards disability inclusion. For instance, we worked with the Employers Federation of Pakistan, which is a kind of a body that is very urban based, and a lot of corporate giants were part of that platform. So we were able to influence their mindset in a way that they could hire a lot of people with disabilities in the textile industry, in sports industries, where they could engage them in the factory work as well as in some of the white collar jobs. But it also depends on the requirement of the job as well as the eligibility criteria and the qualification needed for that. But we have so far worked in both soft skills trainings for the youth with disabilities as well as hard skills training, which is like primarily around technical and vocational part of that. And in that context, we worked very closely with the national vocational training institutes in the government and private sector. We also provided people with disabilities, young people with disabilities, with different opportunities to get enrolled in those programs. We influence the government of Pakistan to make few relaxation in the enrollment criteria so that young people with disabilities have more access and are eligible to be part of the programs. Similarly, for the soft skills training, we partnered with companies like Accenture, which is a US-based digital platform providing skills and training to young people how to get ready as a job seeker. So providing them with the skills of like how to get prepared for the interview, how to make your CV presentable, and similarly in uh, educating them for IT skills, AI based skills. So there's a variety of skills that we provide them for. And at the same time, we also partnered with startup incubation centers who provided support to the young people with disabilities to pitch their business models to them. And it was a very highly competitive process where they could pitch their very innovative ideas, and then in the end it was not just getting the seed money but also getting mentorship and a continuous support for monitoring their business models, how successful and sustainable they are. So there was kind of a like consistent and regular interaction with them for quite a long period of time. So, because we know that in countries like Pakistan and so many other low and middle income countries, government is not able to create so many jobs in countries where there's such a big population. So, we also need to invest in creating more entrepreneurs who can set up and run their own businesses and create more jobs within those businesses. Yeah.
Very interesting. So, Munaza, we have a question from Marina Salman, who's asking, has your organization worked in countries who are in conflict, like Syria and Gaza? She's been working with blind disability organizations in Gaza, and they are in great need of all of these services.
Absolutely, you're right. We are no, not so far. We are not in Gaza or Syria directly, but we are supporting organizations who are working there. So we are supporting them through trainings and through different other interventions. We have been providing support in Yemen and Sudan, and we have presence there as well for combating neglected tropical diseases as well, creating the workforce to tackle the preventable common eye care problems such as cataract and refractive errors and others. So yeah, we do have in presence in some of the conflict zones and areas, but currently we are not directly working in Syria or Gaza. But we would be keen to work in collaboration with those who are present there physically and can provide services for the prevention and control of blindness primarily. Yeah.
And then Munaza, I wanted to ask you, in your experience, what are the biggest barriers to disability inclusion? Like if you've seen any difference across different countries, and then how can we here, like regional foundations in the Arab world, adapt those lessons maybe to local contexts?
So far, our experience tells us that the biggest problem is the mindset and the attitudinal barrier. Because in a lot of very fragile, socioeconomic fragile context, we have seen where there were huge resource constraints and everything. But if the mindset is positive towards disability inclusion, there are ways, there are indigenous solutions to embrace persons with disabilities and make them part of the society. So in my personal view, attitudinal mindset barriers are the biggest barriers. And for that, it's really important that we work very closely with those who have the lived experience of the disability, and also working with strong advocates and also the champions of the national disability movements. For example, in countries like Pakistan and Bangladesh or India and some of the African countries, we came across very strong voices of young people with disabilities who themselves have struggled throughout their life to reach that stage. And now they are like such vocal voices and upfront speakers on the disability inclusion and disability rights, not only in their own countries, but at regional and international platforms. So we really need to learn from them, and we need to make them our frontline soldiers in the fight against the disability empowering solutions. So I would recommend that we need to empower the organizations of persons with disabilities. We need to work in alliances and networks rather than working in our silos. Um, Wherever we have been successful in influencing the policy and decision making processes, the secret behind that was there was a collective voice. We were not talking alone, or we were not raising voice alone. There were a variety of like-minded organizations who were part of those alliances and networks, and as a collective voice we could become a pressure group to influence the legislative landscape, the different recruitment and HR policies in the sectors where we're working. We could influence the health and education ministries. There are still challenges, huge challenges, but the solution is to work in a collective manner rather than in silos. Yeah.
I also have a question from Ola Al-Shorbaji. She says, do you have any plans to partnership with a local organization in Jordan?
Yes, we are exploring different partnerships at the moment, and Jordan is one of the place where we already spoke to one of our PRI NGOs, CBM, who have a country presence there, and it would be lovely to know more about the local organizations. I was really eager to visit Jordan for the AFF partners meeting, which is now postponed, but I have a plan to visit very soon, either in January or February, for the same purpose. So please get in touch with me, and please share your credentials or any other relevant organizations that you have in mind. We would love to know more about them for the partnership collaboration. Yeah.
Thank you, Manaza. And on that note, I wanted to ask, sort of given the context again of the Arab world, what are some of the most promising areas of collaboration or partnerships between Sightsavers and local organizations or foundations, particularly like in the areas of inclusive education and awareness spreading and all of that? So, what do you think?
I think we are very open to all the thematic areas, especially eye health and inclusive education, because we have some very strong and rich evidence available with us to replicate the solutions that have been successful, for example, in India or in Ghana or in Kenya or somewhere in Tanzania. And we can replicate those solutions in the similar or somehow similar context in Arab world as well, because a lot of challenges are very similar to the countries where we already have a presence. Uh, but the key thing is that wherever we work, we always prefer working in partnership with the local governments there, and also the key stakeholders in the non-government sector, and prefer to invest in the existing systems and structures, be it for eye health or for inclusive education or for the economic empowerment and employment sector. For example, under inclusive education, we have a very rich experience of capacitating the school teachers how to include a child with disabilities in a classroom setting. And for that, we have worked with the ministries and with other NGO partners to develop context specific inclusive education training curriculums, the content, and also on guiding the teachers how to use and implement those tools and techniques that are part of the training curriculum. And this is not only for the in-service teachers but also for the pre-service student teacher trainees who are the future teachers. So we work on like many fronts, not only for the service delivery part of the spectrum, but also behind the scene for the policy influencing and creating a more research-based evidence that is grounded in solid statistics and solid findings from the communities in partnership with those communities for whom we work. Yeah.
Thank you, Manaza. And do you find that you have to sort of adapt your programs or your outreach across different cultures or even maybe different religions? Or do you find that you're able to kind of generalize everything across all these borders and cultures and differences?
Um, when it comes to adaptation, we strongly believe in that because every intervention should be context specific. Like, for example, there could be some solutions that are not very relevant to Arab context that are implemented in South Asian context. But most of the solutions, particularly for eye health and education, those are very much aligned with the global strategies and priorities of sustainable development goals, with the United Nations Convention on the Rights of Persons with Disabilities, with the legal framework introduced by the UN agencies in a lot of countries globally. So I would say there are more commonalities than differences. So it's not very difficult or impossible to adapt these solutions in the country specific context. It all depends on the strong partnerships and the collaborations and the kind of a learning available in those contexts through which you can adapt and readapt those solutions for the particular communities that you want to work with and empower them. Yeah.
And Monaza, do you feel like that what would be the biggest barrier for you in your experience across all these different countries and cultures? What is the most basic kind of barrier towards promoting awareness and having a larger outreach about disability rights and inclusion? What is the biggest sort of most difficult barrier to
Um, yeah,
cross?
yeah. Actually, in most of the countries there where we work for, the most daunting challenge is the resource constraint.
Mm,
Not only at the ministry's end, but also in the communities that we work for. And because all these countries are either most of the poorest countries or in the low and middle income countries list, and they have so many other competing priorities. And they do struggle with their fragile socioeconomic and political situations. Their security and defense situations are really challenging and dynamic. So they have to prioritize all those life-threatening issues and problems. And when it comes to influencing them for more resource allocation and support for problems like blindness prevention or disability inclusive education, they fall on at the bottom of their priority list. So it's really a challenging task to advocate the local governments and the other stakeholders for providing more support and for allocating more resources for the type of work that we support. But if we have a strong evidence and if we have a local community support, not only in the form of collaboration, but also we do find in lots of places local philanthropists who are really eager to provide their support in whatever form they can, and they become really strong influencers for us in the government policy decision making processes as well. So it's something that it's like quite a dynamic process and keep on changing. But so far, we do have seen and witnessed a lot of success in policy landscape, in legislative landscape, in a lot of countries where we work. Most of the countries, they have not only adopted and ratified different conventions and treaties, but they also have developed their own local legislation passed by their parliaments and their senate and the regulatory bodies. The challenges are there for the translation of those policies into practical actions, but it's a phased manner journey. So it's a baby steps journey, which has been initiated in a lot of settings in a lot of countries. Some of the countries are quite far ahead than others.
Mhm.
Uh, but yeah, I would say nothing is impossible.
Yeah. So when you say baby steps, I'm sure those baby steps are huge, life-altering kind of steps for the individuals who receive all these the benefits of all your programming. So that's I mean, such amazing change that Sightsavers is providing. We have a comment from Marina Salmen.
Hmm.
This is an excellent and extremely important webinar that AFF has hosted. I am an Arab Jordanian disabled activist from Chicago, and disabled people among Arab communities here in America and across the Arab world has largely been excluded from engaging. Yeah.
Yeah, that's
Would
very
you-
true. That's very true. And Marina, and this is why we always prioritize and ask the governments to prioritize in their decision-making processes. You must have been knowing the a very strong slogan, "Nothing about us without us," by the disability movement globally, and that's the fact that we need to bring them on in the limelight as frontline soldiers, and they have fantastic capabilities to support us and to raise the voices on behalf of their communities. So yeah, I completely agree with you that in most of the contexts they have been largely excluded from the influencing processes, but this is something that we all as a community needs to prioritize in our working relationships in the countries where we work.
Thank you, Manaza. And then, unless anyone else has any questions, I just wanted to ask a wrap-up question. And in case do you have anything that you would like to say at the end, Monaza, let me go ahead and ask you. So here in the Arab world, as we think about the future, what do you see as the most critical opportunities for organizations and foundations in the Arab world to try to adapt and scale your learnings and your programs? And to try and ensure that the most marginalized communities are fully part of these programs that are available.
Yeah, I think the most important thing is to do not create any separate or parallel structure to the governments, because in the end it's the government and the state who is responsible to deliver equitable and inclusive services. uh, the role of the development organizations like us and other NGOs should be to support the existing system. We need to demonstrate the solutions. We need to play the role of a catalyst to expedite the pace of the development and the pace of the progress that we all aim to achieve for. And then we need to make lasting changes in the system that are sustainable. For example, by influencing the policies and the strategies in the health and education system. That's the only way we can make sure that those changes will last even if we are not there. So we do not want to create dependency on the international NGOs or the development partners. We should be taken as friends and supporters who are there to address the gaps in partnership with the local stakeholders. And to create local ownership, it's really important to work very closely with the communities and the beneficiaries for whom we work for. Um, we have witnessed a lot of examples, even in the most poorest part of the Africa, where because of the local community ownership, they are still running those small inclusive education best example and best practices that were initially uh, assumed as a dream, that this dream is impossible to achieve. But with the local ownership and interest and the interest from the government side, those solutions are still workable. People are benefiting from that. So the real strength of collaboration is to work within the systems and strengthen them through addressing the gaps in human resource and service delivery and infrastructure, whatever gaps there are.
I love that, and I wish many more of the foundations and people working in our cultures and countries were more focused on handing over to the local sort of structures. And so we really appreciate that. Thank you so much, Munaza. If you have anything else that you'd like to say, I have asked everyone to email me. There's been a couple of people who want to get in touch with you, so I will definitely send you all of those. And if you have any last words before we go.
It's a great pleasure to be speaking at this forum, and I really look forward to any suggestions or any potential collaboration opportunities in the Arab region. So I would encourage every participants and the attendees to get in touch with me for any information or for any research-based evidence, or for any collaboration opportunities that you think we can together opt for. I would really welcome those ideas. Yeah, thank you.
Thank you so much, Manaza. Thank you everyone for joining us. This will be up on our YouTube channel and our website and all our social media, so you can access it, the recording there. Thank you again, Manaza. It's a pleasure to have you with us today.
Likewise. Thank you very much.
Bye-bye.
Bye-bye.